is Kevin Hay, and I will be performing a thorax, lungs, and cardiovascular assessment. This is my patient. Go ahead and introduce yourself.
My name is Caitlin.
I'm going to go ahead and start here with some simple hand hygiene. And I'm just going to start by taking a look at my patient, noticing that she's in no respiratory distress right now. Respiratory rate is normal, no shallow breathing. Effort of breathing is normal, and she has no signs of respiratory distress, no use of the accessory muscles at first glance. So I'm gonna go ahead and assess the anterior portion of my patient. Go ahead and take a deep breath for me. Okay, thank you. Patient has normal expansion of the chest. Let me go ahead and check for capillary refill. Let me see this one. Okay, capillary refill is normal and is less than 3 seconds on each finger. Let's see. Patient has no deformities or muscle retraction noted. Gonna go ahead and palpate for any tenderness. You tell me, are you having any tenderness in this area?
No.
How about here?
No.
How about here?
No.
No tenderness noted as well. No apparent bruising. Do you notice any bruising this morning?
No.
Let's see. I'm gonna go ahead and assess my patient for any tactile firmitis. So I'm gonna just have you, when I move my hands, go ahead and say the word 99, okay?
99. 99.
Okay, go ahead and lift the breast tissue up here, please. Right here.
99.
And here, please.
99.
Okay, both lungs are resonant bilaterally when testing for tactile firmitis. Gonna go ahead and percuss the chest wall now on the anterior portion. Okay. Lung sounds are resonant bilaterally when assessing the anterior side. Now I will be assessing the anterior chest, listening for lung sounds. I like to start here from the supraclavicular area here to listen to the apex of the lungs. Go ahead and take a deep breath in and out. And I move laterally to the other side, almost in the same position. Okay, gonna move down here. Again. Go ahead and lift the breast tissue up here on this side. I'm gonna do the same thing. And this side too. Lung sounds are normal on the anterior side. No crackles or rails, no rhonchi, as well as no stridor noted. Let's see, I'm gonna go ahead and do the exact same thing on the back side. I'll have you just turn your chair here for me. Go ahead and move your hair to the front. So what I'm gonna do first is check for, let me go ahead and move you a little forward. Gonna go ahead and check for chest expansion. Go ahead and just take a deep breath in and out for me. Okay, one more time. Okay, chest expansion is normal on the posterior side. Rate and rhythm looks normal. Depth of respiration is also normal. No effort of breathing also noted. No deformities noted or any bruising. Also, no muscle retraction, no use of accessory muscles to help her breathe. Does this feel tender at all when I palpate here in the back area?
No.
How about down here?
No.
No areas of tenderness down there. Now I will palpate the chest for any fremitus here. Go ahead and say the word 99 for me again.
99.
Okay, right here.
99.
Okay. Go ahead and do it here.
99.
Go ahead and do that here.
99.
I like noting that above the clavicular are not able to hear any vibrations. However, when assessing the lung sounds here, I'm able to feel the vibrations. Go ahead and say 99 one more time.
99.
Okay, thank you very much. Lung sounds are resonant. No areas of dullness. Now I will auscultate the patient's lungs using my stethoscope. Again, I'm going to start here at the clavicular line. Go ahead and take a deep breath for me. Go ahead and do that again. Again, one more time. Right here. And I'm gonna listen to the right middle lobe right here. Go ahead. Normal lung sounds throughout. No rhonchi, no crackles, no stridor noted. Let's see here. Now, if I can have you turn back around. I'm gonna go ahead and get into the cardiovascular portion of the exam. I'm gonna go ahead and start by measuring my patient's blood pressure. So if I can just have you uncross your legs here. Thank you very much. I'm going to put my stethoscope here. No. Pump your systolic here to about 170, 180. Just to check. Systolic noted at 137. And diastolic noted at about 82. Let me go ahead and check one more time just to confirm that. About 135 over 82 is what I got. Gonna go ahead and note for the heart rate, if I'm gonna go ahead and check the radial pulses as well as the brachial pulses. Heart rate's about 86 on the right side, on the left side. Again, the pulse is about 86 on the right side as well. Gonna go ahead and check for jugular vein distension. If I can just have you tilt your head to the side here. No jugular vein distension noted on the left side. Go ahead and turn your side to the other side. As well as the left side, as the right side, no jugular vein distension. At this point in my assessment, I'm gonna go ahead and assess the carotid pulses here. Go ahead and turn to the side one more time this way. Yep. Carotid pulse on this side is about a 2 plus. Oops, no thrill noted upon assessment. Carotid on this side is about a 3 plus. Bounding. Let's see here. At this point in time, I'm gonna go ahead and listen to the carotid arteries as well, just to make sure I hear no thrills or bruits. Do the same thing on this side. No thrills or bruits noted when listening for the carotid arteries. Let's see here. We'll be inspecting the anterior wall. Here is the intercostal 1 space. This is the aortic intercostal area. This is the pulmonic valve right here. This is the tricuspid valve, and then the mitral valve is here. If I can just have you lift your breast tissue up. This is where we would note the apex as well as the PMI position. Gonna go ahead and listen or feel for the pulse here. And I do feel a normal rate and rhythm here as well. Okay. Let's see. At this point, I will listen to my patients. I will auscultate the areas that I was noting. This is the S1, the intercostal space 1. Patient has normal S1 and S2 sounds here. This is the S2, the pulmonic valve. Patient also has normal S1 and S2 here. This is Erb's point. This is intercostal 3. Normal sounds here as well. The tricuspid valve here. Okay, if I can have you lift up this breast area again. I'm going to listen to the apex of the heart as well as the PMI. And it's here at the midclavicular line. Normal rate and rhythm, normal S1 and S2. No, let me go ahead and identify for any murmurs. So by using the bell of my stethoscope, again, I'm gonna check here. I hear normal heart sounds. I don't hear any heart murmurs. No S3 or S4. S1 and S2 is normal throughout heart. Normal pitch. Quality of the rate and rhythm is normal. At this point, I'm gonna go ahead and check for the femoral pulse. Go ahead and let me just get an assess right here for the femoral pulse. I'll do that here as well. Okay, gonna go ahead and check the popliteal pulse here on the bottom. Pulses are about a 2+ bilaterally. Let me go ahead and have you take your shoes off so I can check for the pedal pulses. Check this side. Okay, pedal pulse is normal on the left side. Okay, as well as the right side. Normal pulses throughout bilaterally on my patient. Let's see here. This concludes the end of my thoracic lung and cardiovascular assessment. If you have any other questions, please let me know. Thank you very much for watching.